Myocardial infarction results in scar, and there are many ways to help that situation with optimal medical care, with quick recanalization, but there's still scar. And when that happens, one of the things that they've been looking at now for more than a decade is cellular therapy. But as our guest noted in the paper in JACC, it's been kind of elusive over the last 10 years or more. I'm with Dr. Eduardo Marban, MD, PhD, Director of the Cedars Sinai Heart Institute, and you've got 20 years of research into the heart and how it works at the molecular and cellular levels. Tell me about the CADUCEUS trial, because this is kind of exciting and it's coming up in JACC.
So in the CADUCEUS trial, we took biopsies from patients' hearts, grew heart cells that are regenerative from those biopsies and put them back into the infarct-related artery in patients who had had a heart attack some 3 months before. And the goal was to achieve true regeneration of the injured heart.
And what did you find?
Well, we were challenging traditional teaching because we're all taught that scar, once is present, doesn't go away on its own, and that living heart muscle, once lost, doesn't regrow. And that's, in fact, exactly what we found in the patients who were randomized to control to standard care. No change over 1 year in either of those parameters measured by magnetic resonance imaging. But in the treated patients, treated with this cell type called cardiosphere-derived cells, or CDCs, they had a remarkable shrinkage in the amount of scar by about half, and regrowth of much of the lost myocardium, about 22 grams, which amounts to about half of the heart muscle they'd lost during these pretty large heart attacks.
Now, the main primary endpoint, I believe, was safety, and that certainly came out to be safe.
Yeah, so it's a phase 1 study. This had never been done before in humans, and of course, the objective of any such study is safety. There wasn't any signal indicating that the cell-treated patients did any worse or any better in that regard in terms of safety from the control group, but it was small, 8 versus 17 patients.
You've been working in this area for more than 2 decades. It's been elusive, as you say, trying to find something that works. Are we closer to it now, do you think?
I think we are. The record with bone marrow-derived cells, which is the one that goes back to 2001, now has an experience of nearly 3,000 patients worldwide. And whether that's going to turn out to be efficacious is still undetermined. There's a large phase 3 study going on called BAMI in Europe, which will look at its effects on mortality once and for all. But it's definitely safe. And so the field has been advanced by the finding that intracoronary cell therapy can be administered safely. Now the race is on to find the best cell type and probably the best endpoints. We really don't know, other than mortality and rehospitalization and traditional hard clinical endpoints, which are some ways down the road relative to phase 1 studies, what we should be looking at in the first instance. We thought scar size is very reasonable because that's the best index of regeneration.
Now, in terms of a phase 2, where does this go from here?
Well, since we performed CADUCEUS, we had a eureka moment, which taught us that basically we didn't have to do biopsies from patients' own hearts and do so-called autologous therapy. We could do universal donor therapy, off-the-shelf allogeneic therapy.
Oh, wow.
So having developed that entire paradigm, we now have switched our efforts to doing studies that don't require biopsies and reinfusion of autologous cells, but rather take cells from a bank and give them to a volunteer that way. That study is called All-Star. It's a phase 1 and phase 2 study. The phase 1 component has recently been completed, and phase 2 should start early in 2014.
Well, congratulations, because it really does seem like this is moving ahead at a pace that we've wanted to see for a while.
Well, I think the field has gotten a lot of momentum. This study, some other recent studies with mesenchymal cells and with other heart-derived cells look very promising, but a lot of things look promising in phase 1. We're eagerly awaiting the phase 2 results.
And again, the study itself is intracoronary cardiosphere-derived cells after myocardial infarction, evidence for therapeutic regeneration in the final 1-year results of the CADUCEUS trial. And it is in the January 21st issue of JACC, that's 2014. For CardioSource World News, I'm Executive Editor Rick McGuire.